We have Dr. Ann Poblutsky, the territorial epidemiologist, and Annette Uggan, who is the lead of the public health contact tracing squad. Good morning,
Good
Annette.
morning.
Good morning, Doc.
Morning.
Morning.
Good morning. Nice background.
Wow, Annette, they gave you an upgrade to your office. I'm so happy for you. You're like, you know what, Bust? I'm gonna work outside. That's fine. Where's your background from, Annette?
That's Fiji, actually.
Wow,
Oh,
it's
it's nice.
Wow, so we're getting charged long distance for this interview, huh? Is that your?
Covering up all my.
What was the question?
All right, ladies, and then can we just get we'll just get right into it. As the contact tracing and lead, we're seeing these crazy positives, the testing positivity rate. What's the status, and what can you tell us about who is testing positive for COVID-19?
We're still seeing, unfortunately, household members, which again is to be expected. They are at higher risk. And then we do have some community contacts, be it coworkers, and so unfortunately they're not knowing. We're still seeing asymptomatic individuals not knowing that they're positive and bringing it home to their family, and again, that's how it's just spreading out in our community. We've seen a wide age range over this past week, and unfortunately we've had recent deaths in this past week, and so we're seeing minors all the way up to the elderly being affected by this. And so again, it's definitely within our household members and our coworkers and friends that we're seeing this spread.
Yes, and if you want the numbers, Stephanie ran the numbers on 1,100 of the 1,500 or so cases and found that 60% have been asymptomatic, 40% symptomatic. So if you're asymptomatic, that you mean you don't have any symptoms, but you might have had a contact with someone, and that's a problem with this novel coronavirus. People can be spreading it without knowing it. That's why we ask people to wear masks and social distance. And if you're positive, stay home, isolate, stop the spread.
But it says my name, not yours.
Huh?
I'm sorry, I'm having trouble hearing what?
Sorry,
no.
we got a Zoom. Somebody jumped in the Zoom and didn't mute themselves. Sorry about that.
Oh, okay.
Annette, so just going back to the status of the contact tracing, we heard from Dr. Wen. He obviously expressed the concerns he had with the lag in the contact tracing. And I mean, I feel like every time we get you on here, we ask you, hey, is public health doing okay with the contact tracing? You always say yes. But I mean, I got to ask again, is public health up to date with the contact tracing? Are you guys overwhelmed? Do we need to? We had the Guam Nurses Association put out a call for nurses, and Dr. Wen had said that we're looking at some of these GovGuam employees who are staying home, earning a paycheck. Let's get them to work. Is that going to help? Do you guys need the help? Where are we at with contact tracing?
Yes, actually, we put out a call to as our numbers continue to rise, and we were seeing that backlog and being overwhelmed. We were able to get assistance, like with DYA. We were fortunate that we've had 4 staff temporarily assigned to us, like a 2-man team rotation. Dr. Wen also mentioned how Port Authority of Guam, they had several of their staff take the training, and so they were in communication with our team to assist us. GMH helps us with contact tracing at GMH. It's a collaboration there. This effort too with University of Guam and UC San Francisco. We already had our own separate meeting in regards to trying to pilot a team at UOG, be it students or those who just completed the course that will end today, to help expand our manpower. Department of Labor too has helped us. They received their own federal funding and provided us some personnel who have stepped up to do more than just data entry. They were very interested in contact tracing, and so they've taken the training, had the mentoring and shadowing opportunity as part of our training, and so they've also stepped up to do that. And then within our department, we have across our other divisions who are also taking the training, have started to be mentored and shadowed. Again, like Dr. Wen pointed out, it's you need to be trained, not just take the course online. There's more to it than that. And so those are the things that my staff are trying to juggle, the team is trying to juggle between actually doing the investigation and contact tracing and trying to bring on people. So we do have some individuals too who are doing other COVID-related response activities, like Grace Berdallo, who's our PIO, also comes in and helps like after hours on weekends. We have other staff, again, do their regular duties and come and help us. So that is how we are definitely trying to expand. And again, other agencies too have reached out. The class that Dr. Wen mentioned has a mix of like not only UOG students and nurses, but also we have Guam DOE, we have judiciary. My understanding is also National Guard is there. And so we hope to utilize those individuals to be maybe now our point of contacts at their respective agencies. God forbid they should have a case, then we can tap on them and to be an extension of our contact tracing team.
So how far behind are we on the contact trace investigations? Because you just got 74 new ones last night.
Yes, some of those though are within the same household,
Okay.
and so the contact tracing is pretty much done. It's just unfortunate that they went from being a close contact to now a new positive. So that kind of helps us in the workload, in that we don't have to re-interview them in regards to if they're minors and just been staying at home. It's just if individuals who are working, now we got to look at your work side as well and see who are close contacts there. Normally, we really try to do our investigations within 24 hours. That's the ideal, as Dr. Wen mentioned, and that's been our goal all along. But as the surge happened, we unfortunately fell back a little bit. We were looking at 2 to 3 days, but our team is catching up on that. They're working into the night, Saturdays and Sundays. This holiday coming up, what holiday? There are plans already to come into work because, again, as we deal with closing out cases, like you said, last night we have 74, and so we have to clear out some, and then we get new cases that are added on to each investigator and contact tracer's assignment.
Dr. Ann, and then maybe Annette too, when you talk about 60% of the cases that you had looked at being asymptomatic, is there any thought at all about, and we always hear from some of the doctors that people are breaking the home quarantine, which I can only assume means they're also breaking the home isolation, or in a lot of cases, they don't have the means to adequately isolate themselves from the other members of their household. And I think we're seeing that with the spike in household positives, like you're saying, Annette. So I guess that being said, do we need to have the conversation about just sticking all the positives in the ISO facility, the government of Guam ISO facility?
Well,
Not necessarily.
No, you go.
We've had instances where there was a positive case in the household and nobody else in the house became positive, that they took the necessary precautions. They social distance, they took shifts, be it for eating and the restroom, if that was the case in that household. So we've had our success stories that maybe have not been put out there to the media to know, or the public, that we have people who are compliant. We've had some individuals who, because of the situation that they were close contacts to a positive case at the house, that they asked to be quarantined, to be removed out of the house and be quarantined at the quarantine facility. So it can work either way. Then we do have individuals who've asked, can I be moved out into the isolation facility? And so that's what's being accommodated with our containment and infection control branch. And as you've seen, we've increased our capacity for quarantine facility as well as for the isolation facility to help accommodate these issues and not just those arriving passengers.
So no.
Yeah, no.
In regards to sticking everyone into an isolation facility, again, there are some instances where their family members are their main caregiver.
Right.
And so to stick a non-positive case into an isolation facility, that's high risk.
Right.
Again, and we're also looking at people's comfort. They're you want to recover at home, so that's a psychological benefit as well. And so we do have those instances where, we're okay. We will just take the necessary precautions. They will be checked on by our isolation and quarantine teams. And then other individuals, unfortunately, it's very difficult for them to meet those necessary self-isolation guidelines. And then we have to make accommodations or see if some of them don't even want to go to the facility, but maybe they have a separate house they can go to, a different family member that they can separate from, or utilize a different home. And so that's something that our team works with case by case basis.
Dr. Ann, so we're doing a mass, a limited mass testing tomorrow, 200 people at Talafofo. What are you anticipating we're going to see?
I have no idea. I have no idea. It's quite widespread. We're still seeing that, we have 1,560 cases. We've got, the hospital is full. So I assume we're going to see a lot more positive cases, and the governor is anticipating, or at least according to the media, continuing the lockdown. And I think this is good. And I think, the stores are open. People can still take care of, getting food, whatever. But this issue about banning large gatherings is really important, because that's what we've seen with the contact tracing and the clusters is large gatherings, churches, etc. And that's why it's probably a good idea to keep these numbers down by preventing these kinds of large social gatherings, funerals, churches, etc.
When you say churches, are you talking about like the parking lot masses?
I'm sorry?
When you say churches, are you talking about like the parking lot masses?
Are you talking about the parking lot masses when you
Yeah.
say churches,
Yeah.
or are you talking about some other?
Funerals, yes, church gatherings. I don't know what's going on with the outdoor masses or whatever, but we have seen some clusters associated with churches earlier in the month.
Right.
People were talking about significant clusters, and what we've seen, that's one of them.
Before you guys released the name of the church, it was Iglesia de Cristo. And I've heard, from different people who know people that go to a couple churches where they were telling me, hey, yeah, there's a cluster there. We haven't heard anything out of you guys. Are we naming the churches? Because we did see that there was a church that was cited
Yeah.
last week because nobody was wearing a mask.
This was on August 23rd. This
August
was
23rd.
This was from Division of Environmental Health, their COVID-19 inspections. And so it says Calvary Chapel, Assen, August 23rd, failed to enforce mandatory use of face mask, failed to have an organization-specific guidance plan, failed to adhere to authorized number for social gatherings, and then failure to adhere to Public Health Guidance Memo 2020.
Well, it sounds like that's our cluster, huh?
No, we're not saying that. In regards to the parking lot, that's one of the measures that like the Catholic Church has taken to reduce a large number of people gathering in the same enclosed space. So what we're in regards to social gathering, it's if situations like that or other religious groups or organizations where they're still having gatherings of more than 20, 25 people in one big area in closed space, and then they're not following the social distancing measures as well as wearing the mask. And unfortunately, that's where we're seeing the fallout when people don't follow those recommendations. We let our guard down. And again, we think we're safe with family and friends and not realizing, like Dr. Ann said, 60% are asymptomatic. So you think you're okay. I know Dr. Wen mentioned in a previous interview, it's actually through family and friends that they're spreading it because you don't know, and that's how it's going from household to household. Unfortunately, bringing it to your work site, exposing your coworkers, and they bring it home to their family. And that's why it's just this huge domino effect, and that we ask for people's patience as well as their support, and to continue to be responsible as an individual and as a community, because that's the only way we can help each other, because again, we can't do it alone.
All right. Can you just walk us through, and I know you're not with environmental health, but I'm pretty sure they put you guys in the loop. So August 23rd, that was a Sunday. All right. And according to this report, nobody was using the masks. So if I'm the environmental health inspector and I stumble on this scene, whether it's, from a tip or what happens when I go in and I see, nobody's wearing a mask, they're not social distancing. Do they shut it down? Do they tell everyone, hey, go put on a mask? Is it a disperse kind of thing? What happens? Because this is the number one thing we're being told not to do. Don't gather and wear the masks.
Correct. And that's why they've been going out there. As you can see, they've expanded from just businesses to even funerals that they've been asked to check on for those type of gatherings like that, and then to basically inform them of the violation of the executive order or our guidance memos, and to have them
So what happens though, Annette? Do they got a box?
We don't have a public health police force. We can't go out there and police everybody. The Physicians Advisory Group suggested partnering with the mayors so that the mayors could do this kind of thing,
Right.
you know, doing surveillance in their village. But it's really about people being responsible. I believe one of the churches was cited for that, but they refused to comply. We also have that, you know, people or groups will refuse to comply. That puts everybody at risk.
Yeah.
What does the community want to do about it? We don't have a public health police force
Right.
going out there and doing citations.
Right, but they do citations.
we should,
yeah,
right?
no, I mean they did get cited. So I'm trying to ask is when they bust in and they're like, hey, no one's wearing a mask. Do they make everyone put on the mask and then continue as you were, whatever Bible verse you were on, or do they just say, hey, you guys aren't wearing a mask? Okay, see you later. Tickets in the mail.
No.
No, we so right now the penalty that they're talking about is those who violate the quarantine order that they've signed, right?
Right.
So that's the only thing that we've seen where, and already one case was taken to court. In regards to this, when people are not providing or complying with the social distancing, they're cited, as Dr. Ann said. But after that, our enforcement is just to advise them of the recommendations, to comply with it. And again, we don't have additional authority to tell them, you know.
What about that whole
discontinue
the public nuisance thing? I thought we could cite people for being a public nuisance.
You could, but we're not the police. We
Right.
would have to then call in. And that's why this discussion about a recommendation to have like the mayors of the different villages
Mm-hmm.
come in and assist us, because that's beyond our public health authority to
Right.
do that.
Yeah.
Right, but
we definitely
this
need
is the
assistance of Police, Mayor's Council of Guam.
this is the Division of Environmental Health that's going out and inspecting
Yeah.
these facilities, and this is on top of their regular sanitary inspections. And they do have, don't they, the power to
Yeah, they could shut you down.
like restaurants,
Shut
because I
down.
know that they've shut down, you know, different restaurants when they do their regular sanitary inspections. But yeah, it doesn't indicate here like if they were shut down, as opposed to like I get the other ones with the sanitary inspections, and it does tell you like
Right.
whether they were shut down or not.
And Matt,
I don't know if this is new because I only started getting these like a couple weeks ago.
Right. I just got to break in here, ladies. It's 8 o'clock. We're KUAM FM in Agotnia, Guam. Thank you so much to our viewers on KUAM TV 11 for watching. It's the link on the Breeze 93.9. We're currently interviewing with Public Health. We have the territorial epidemiologist, Dr. Ann Pobutsky, and Annette Uggan from the Public Health Contact Tracing. The conversation right now is centering on a local church that was issued a violation from Environmental Health for having a service in which nobody was wearing masks and they weren't social distancing. So jump on over to our KUAM News Facebook live feed and get right back into the conversation here on the link. It's The Breeze 93.9. Thank you so much, TV 11.
The one good thing I think about this though is the fact that you know that public health is out there, right?
Yeah,
And they're
yeah.
doing these inspections and making sure people are following the guidelines. So kudos to Tom
Right.
Nadeau and
Yeah.
his
I mean, that's the
people.
good thing. But then on the flip side of it, if I'm a church, I'm hearing this conversation right now. I'm like, okay, we got a citation, and they didn't call the cops. They didn't call the cops.
Yes. DEH staff can call the cops if they're not already accompanied with them.
Right.
But as in for DEH Public Health to close them down, that's not that's
Right.
not for us. It's GPD will turn around and enforce that. In regards to the sanitary permits, that's prior to COVID. That's a standing
Right.
enforcement that DEH can enforce and implement. But in regards to the social gathering, DEH can cite them, but then they call in like GPD to enforce
them
that.
Right.
Mm.
Yeah,
So
but
again,
when we,
it's not public health doing the
Yeah,
closure
yeah.
for not following the social distancing measures and the guidance memo and the executive order. We call in our law enforcement partners who will then deal with that organization
Right.
to shut it down
But
or
you
to
don't-
comply, as you say, put on the mask.
but Annette, in this case, you don't know if Environmental Health called GPD.
Yes, they are with. I can't go into. I don't know all the details,
Okay.
but DH is normally a company with GPD, and then they can call them in to deal with the, like you're saying, to shut them down or either comply with the requirements so that they can continue on. So yes, they would inspect. They notice the infractions or the violations. Then GPD is the one who steps in and will either shut them down or require them to comply with the measures.
Dr. Ann, I wanted to ask you because there was a story that had come out yesterday about a vaccine. And I mean, Saipan had this story a few days ago where they said they were advised to prepare for the arrival of a vaccine, which, I mean, they didn't have any real details on it. What I know, this is probably something you're tracking. What can you tell us about that?
Well, there's supposedly announcement that there's going to be a vaccine available shortly, but I don't know the details, and I also don't know. I believe it's an emergency use authorization vaccine, but until I hear the details, I'm not going to talk about it. As a matter of fact, we don't even know if it's safe, what kind of trials that they did, because this usually takes a long time.
Right.
But let me also suggest that we should talk about immunizations and COVID-19. We've got flu season coming up. People who are at risk for influenza. We don't want to see a double epidemic going on. I think that's a topic that we can address. And you've got Annette used to be head of the immunization before she got bumped up to head the entire Communicable Disease Bureau. Yeah. This is an important topic, and they're gearing up for mass immunization because people aren't getting immunized. Their kids aren't getting immunized. And we need to start talking about the flu vaccine before we even get to a vaccine for COVID. Okay. Because you certainly don't want to have the flu and then get COVID. So and I have a list of other topics that I would also suggest later. Annette?
Should people go out then and get the flu shot during?
That's why I want Annette to address this, because the Immunization Bureau is doing some plans to gear up for immunizations for kids. Okay. And there's some guidelines on influenza as well for elderly people, people at risk. It's the same story that you need to get your flu shot. And this is coming up here. It's already September. Right. Annette?
And we normally would see a spike in influenza cases in August when schools reopen and, and it's rainy season. And so this is definitely something that nationally it's a priority to increase our influenza vaccination. So as Dr. Ann mentioned, we don't want to have both flu and COVID circulating in our community. Some of the symptoms are the same. And so if people we don't want to inundate our healthcare providers and the emergency room. They're already overwhelmed with COVID alone. And so we definitely want to encourage individuals to take that seasonal flu vaccine while we wait for the COVID vaccine to be released. And so again, when Saipan gets their COVID vaccine, Guam is going to get their COVID vaccine, but we definitely need to wait for the details of the safety, the efficacy, and what are going to be the recommended age groups. Is there a minimum age? Like for influenza, it's 6 months, but we still don't have all those final details for COVID. Are we talking about 1 dose or 2 doses for the COVID vaccine? What are the storage and handling requirements? Because that's a concern nationwide. Are we talking extreme freezer storage, or is it something that we can use, with our current pharmaceutical grade freezers? And so that's definitely something that the mass flu vaccine is our warm-up to the mass COVID vaccine campaign that we will push out. We have to also monitor about allocation. Are we looking at limited supplies coming in, in piecemeals? And so that we're going to have to prioritize priority groups like we did back in H1N1. We have to look at the front line, the elderly, those with medical conditions. And so those are the things that now, while we're juggling COVID response, we're ramping up our mass vaccination plan so that we can deal with the flu and then turn around and revise it once we get the final information for the COVID vaccine. And then again, it's going to be a community-wide effort for pushing out the vaccine so that hopefully this can help prevent you from getting it, and so that we can bring down the number of cases that we would have to deal with because now we have the vaccination to prevent it.
And how soon are you going to roll out the mass flu vaccination program outreach?
We're going to do it actually in different pieces. We're going to rely on our public and private partners. We were fortunate enough that CDC gave thousands of extra doses of seasonal flu than we normally would get. And so in the past, we would have to limit. Now it's kind of, let's open it up and give as many as we can. We're going to work with community vaccination partners, be it the private sector, if we can hire some vendors to go out and immunize people for us, while public health also does mass vaccination in the community. Give it out to our healthcare workers to immunize themselves and their clients if they choose. And so as soon as we get our vaccines in, that is going to be rolling out quickly. Again, depending on the stock that we receive, do we have minimal numbers that we need to prioritize, or can we just get a huge supply in and then we can distribute it widely and have many venues for people to take the opportunity to be immunized?
But people can go now to their regular doctor, right, and go get this vaccination, and that is something that you recommend.
If the provider already has it. Public
Right.
health, we unfortunately normally get it a little bit after the private sector, because we get ours through CDC, then it's redistributed out to all the grantee jurisdictions. And so once we get ours, then we definitely will be pushing out to our public and private partners.
How can you tell the difference between if you have the flu or you have COVID?
You might not. You might not. Some of the symptoms are the same. The only way you can know is to test.
Okay.
And that can be done. We can test for flu and COVID and RSV and all kinds of things. So we're trying to get that going as well, because, yes, as Annette said, we usually see flu start when the kids go back to school and infect everybody.
You know, Sabrina's been asking this question, several of our guests throughout this week, and I guess we'll start with Dr. Ann. We had you on, I want to say, a couple weeks ago, and you had said, hey, I don't even think the kids are going to go back to school this year, right? And now, nothing has improved since that last conversation. We're hearing from the Guam Memorial Hospital that the number of people on the ventilators, at least from our last count, has tripled. That, the hospitalizations, as predicted a couple weeks ago, continue to surge. That being said, the question that Sabrina has asked our guest, she asked former Governor Carl Gutierrez this just yesterday. Are we going to be okay?
I don't know. I think it'd be good for you guys to have someone from DOE come on the show and talk about what their plans are. New York kids have gone back to school because they had that huge surge and it went down, and they're doing a lot of mitigation. So it could be that we give every kid a face shield and have them decorate it with their name and, I don't know, plexiglass, social distancing. I don't know what the DOE plans are. I also don't know what the governor has decided to do, but it's really important for kids to go to school. Maybe they're going to do online learning. I don't even think UOG is open yet. So this is not my call,
Yeah.
there are things that the DOE is probably planning, and I think it'd be good if you guys do a show with them and see what their mitigation plans are for bringing kids back to school once that might happen.
Yeah, Doc, we do get them on every week, but I'm speaking more generally, with the spike in the cases and everything else that we're talking about this morning. Do you think the people of Guam and the island of Guam is going to be okay?
I don't know.
We're a resilient island. Our people are strong. We will bounce back. We again just need to pull together. The numbers are still high this week, but it's not as high as last week. So hopefully that's a small glimmer of hope. And again, if we continue to do the social distancing and, stay home if you're sick, cover your cough, wear your mask, don't go around if you're symptomatic or if you think you've been exposed. Get checked if you think you are or you have symptoms. Those are the ways that we can help, bring that, flatten that curve. But again, we don't have as many cases as we saw last week. It's still too early to say. We're, to open up more, reduce restrictions and open up more things. No, it's still too early to say. But at least our numbers are slowly going down. It's not low like where we would like it to be, but our people have complied in the beginning when we did lockdown in March, and we saw that we flattened that curve. So again, we can do it, and our people are resilient, and we will persevere through this. And so we are getting assistance through from the federal side in regards to GMH. And so again, that's where I know Dr. Wen also mentioned, if someone's feeling sick but it's not urgent, don't go to GMH. Go to a private clinic and get seen, because GMH is overwhelmed as is.
Thanks, Annette. We do have a question from one of our viewers, and I think this question has been asked in the past, but Melanie Untalon is asking, if you were positive with COVID, can you get it again, or are you immune?
It's possible.
Yes, it's possible.
We have heard, this was last week, we talked about out of 24.9 million cases on the planet, yes, they're seeing people who may have been reinfected. But again, the science seems to suggest that you will develop antibodies. And so if you do get it the second time, maybe it won't be as bad as the first time. And we really don't know. They're working on this. Yes, there's several cases of people who have been reinfected, but the science seems to suggest that people do develop antibodies to the virus, and that when they get it a second time, it might not be as bad. And we don't know how long those antibodies will last. Coronavirus is likely to be around with us, all of us on this planet, for a long time, which is why we need a vaccine, and we need the scientists to really look at. There's not just one coronavirus. There's hundreds of them. Mm-hmm. This just happens to be one that we haven't been exposed to, and that's why it's called novel coronavirus.
Yeah. Annette, I just had maybe a last question here, and it involves military positive cases who come into contact with civilian members of our population. So I know somebody who had contact with a positive case that's serving in the active duty military on Guam. And when this person had contacted public health, they basically were told that they can't contact trace on the military side. So, and just to clarify everything, if I'm, for example, if I'm in the Navy, all right, and let's say I'm dating a local girl or, whatever, a local guy, I pop positive, what's the protocol for the people I come into contact with who are not under that military umbrella? And then what authority, if that's the right word, does your department have to, again, across the fence and fold in that part of your contact tracing investigation? Because I remember back with the airmen, you had told us that there were issues that you guys had with trying to conduct your contact tracing in terms of you conducted, but you hit that roadblock when you hit the military fence line. So just a status on that.
So again, we still partner with the military, both Naval Hospital and Anderson Air Force Base. We actually have a weekly call set up to discuss and give each other updates in regards to cases that cross the gate, right? So if an active duty member is positive, that is handled by the military. If they live on base, they take care of their contacts, the household members and on base. If there's residents who live off base, local residents who live off base or been in contact, be it because of work exposure or because they're identified as close contact by having get-togethers, then the military will notify public health, and then we will work with them to do those residents who are outside the gate, and we've done that in the past. And again, we rely on the information given to us by cases, be it military or a civilian. What the information given to the contact tracer is what the information we go off of who are identified as close contacts, and we will investigate that and reach out to those individuals. So if we're not informed, and again, this is something not just for the military, it's even if it's a civilian individual, if they do not want to be open and cooperative with us, we're going to go off on the information you provide us. And then unfortunately, we do get calls from other people saying, no, I know this person is positive, and how come I haven't been called, to find out they weren't named. And so unfortunately, that's how we will work that angle. We will work with that individual who's stating, yes, I was exposed to someone who was positive, and then we will interview them and set them up accordingly for testing as needed, to advise them also of quarantine if it's needed. But again, we rely on the information reported to us. Same thing for the military side. They rely on the information given to them by the case. And then we have a joint information, a sharing of information saying, can you guys handle these individuals because they're outside the gate, they're local residents.
Well, we're going to wrap this interview up, but, we're heading into a 3-day weekend. I think it's Labor Day, I think. Dr. Ann, is there anything you would like to say? Because, like I said, it is a holiday weekend. We still have knuckleheads out there that think it's okay to go and, party and whatever. So is there any parting words you have? Any message to the community?
The message is the same. Don't have any large parties. Don't go to church. Pray to God on your own. Wash your hands, social distance, wear your mask, keep your family safe. Yes, the governor said it's okay to go to the beach. If you're in a small group and the kids want to play, that's fine. Don't go join 50 other people. Basically, don't have any large gatherings and keep doing what you're supposed to do. Be patient. This is not over. We don't want to see people coming to the hospital. The hospital's full again. We don't want to see it. We don't want to see people going to the hospital. And if you have a chronic disease at any age, or if you're elderly, be even more careful. And I think that's another topic for your show. Talk about chronic diseases and COVID, people at risk for severe reactions and death. And let's think about some other topics. You can also deal with social determinants of health and COVID, disparities in COVID, health literacy and COVID, and you might want to even get some of the faculty from UOG on some of your shows. Talk about the College of Tropical Agriculture, why gardening is great in a pandemic. You can grow your own
Hey,
food.
okay, Doc. Doc,
Climate change and why we are seeing this kind of virus during this time of global connection and deforestation and the ecology and the environment. Get some other topics, not just our day-by-day, play-by-play of what's going on.
Well,
People
thank
know
you.
what they need to do. The community is not stupid. They know what to do.
There you go.
Well, Doc,
Thanks, Dr. Ann,
Yeah.
the territorial epidemiologist / executive producer for the
topic.
link.
Hey, Dr. Ann, can you give your list of topics over to Annette, and then she could WhatsApp it to me, and we'll send you a small check for your input.
Very small.
Very,
Okay.
very small. Very, very small. About as small as a coronavirus.
Okay.
All right. Thank you, Doug. Be
Thanks.
safe. Annette,
Yes, sir.
Thanks, Annette.
thank you for bringing us to Fiji this morning.
You're welcome.
And be
Thank
safe.
you, and be safe as well. Thank you.
Okay, wash your hands, all right?
Yes, and wear your mask.
I
Social
am.
distance.
Always. I'm even matching today.
Get some rest.
Right. Okay. Okay.
if
Then.
that's even possible.
All right, 8:19. Hey, we got to take a break. We're coming back with your village mayor. That's right, your mayor is going to be on the link, the Breeze 93.9.